Hello and welcome to today's funding proposal by the Save Lives Maternal, Children Health and Nutrition Division. My name is Daniel Roach and with me today are my colleagues Carla and Arrin Wislang. Thank you for the opportunity for us to present our funding proposal to the Angalsi Department of Communities, Disability Services and Seniors. In front of you you'll find a copy of the presentation you're about to receive. Firstly, I'd like to give an introduction and background into the Save Lives organisation and who we are. Save Lives is a non-government organisation that specialises in maternal, child health and nutrition, and even though we're an international organisation, we specifically are involved in the region of North East Africa. Save Lives organisation has been operating for the past 40 years and provided relief and recovery to disaster-affected countries. In accordance with professional standards, the Save Lives organisation uses systematic evaluation methods, including risk management, coordination and governance. Internal and external auditing provides assurance to the Board of Management and Chief Financial Officer that objectives are being reached and operations are improved. The situation in Angalsi. Due to the impact of climate change and drought, Angalsi is becoming one of the most vulnerable countries in the world. The Next Generation Africa Climate Business Plan projects that extreme climate events will increase, this negatively impacting the availability of health, water, sanitation and hygiene, in addition to loss of livelihoods. Multiple NGO aid agencies, including the Save Lives organisation, are operating in Angalsi, improving the situation with around 20% of the population considered to be at level 2, stressed, with around at least 1 in 5 households having adequate food, as well as minimal foodstuffs for their livestock. The majority of households are in the next phase, this being able to meet essential food and non-food needs. It's critical that Angalsi be provided with external assistance for future sustainability. Save Lives is a non-government organisation that has been engaged to coordinate the response to current crisis. Save Lives is committed to ensuring local communities take the lead in recovery planning to reinforce ongoing ownership and sustainability once the organisation transitions out of the region. Save Lives conducted an initial assessment situation report which details immediate relief and recovery activities including water purification tablets, emergency feeding programs and urgent preventative supplies for vaccinations. The major recovery objectives are to increase the community's ability to recover, increase resilience, and ensure a level of preparedness to protect against future droughts and other disasters. Urgent support is required for the following proposal, targeting community-led solutions and delivery methods to build resilience to climate change. This proposal includes a comprehensive list of recommended objectives to assist recovery from current and future climate risks. Through recovery research, the recommendations provide sustainable solutions that meet the needs of community, focusing on health, water, sanitation, hygiene, and animal husbandry initiatives. As smaller farmers depend on livestock production for their livelihood, climate change adaptation for this sector of the community is essential. In addition to PPR, barriers for small-scale farmers include low-quality feed, heat stress, lack of water, ticks, and decreased conception rates. The major response objectives during the initial phase was to ensure that women and children had appropriate communicable disease protection. The Save Lives Situation Report of 2020 provided evidence that communicable diseases, predominantly cholera and rotavirus, can devastate certain populations, such as pregnant women and young children during prolonged drought or flooding in the Horn of Africa. Small ruminant subsistence farming, predominantly sheep and goats, in the Horn of Africa is prevalent in rural areas such as in Angalsi and in the neighbouring country of Ethiopia, which has a similar subsistence farming profile to Angalsi. This type of farming provides the livelihood and food resources for 93% of the households. Although there is limited information regarding internal aid and funding animal disease management programs as part of the disaster management, there is a significant body of research that demonstrates animal vaccines programs protecting herds, therefore supporting community livelihoods and well-being. Livestock share the same health risks as humans during droughts, and the poorer the base health of the animal, the worse it performs during drought stress. They recommend that the animal vaccine programs are funded as part of the response, as baseline health and well-being of livestock is vital to survival, as livestock is used for economic benefit by selling meat, milk and other animal products, meat and milk for consumption, which reduces the risk of malnutrition and associated health impacts, skin, wool and fur for clothing, footwear and other products. As noted in the Save Lives Situation Report, poor livestock conditions play a significant role in contributing to the risk of human famine and malnutrition, therefore increased risks of communicable diseases. A post-disaster needs analysis revealed that the people of Angalsi suffered stress resulting from reduced water accessibility, deterioration of sanitation facilities, and poor hygiene practices. The following observations were recorded in Angalsi, which are consistent with lessons identified in the Kenya Post-Disaster Needs Assessment for drought. Women and children are disproportionately affected by droughts. 90% of water collection is the responsibility of women and children at the expense of education and economic activity. Women and children are often left at home, leaving them vulnerable while men tend to livestock. Increased risk of gender-based violence, early marriage, pregnancy, abuse and exploitation. School attendance decline due to time spent fetching water. Poor access to water increases vulnerability. Increased risk of gender-based violence, including issues of protection and the right to justice and access to resources. Increased waterborne disease outbreaks due to the lack of water, poor sanitation and hygiene. UNICEF estimates that more than 90% of the deaths from diarrheal illnesses in young children can be attributed to unsafe or inadequate water, sanitation and hygiene practices. There is a high likelihood of rotavirus and cholera outbreaks in drought-affected areas. Diseases prevalent in stock increase the risk of poor outcomes of farming animals across the country, leading to increasing pressures on community health and wealth. The success of a major recovery objectives relies on funding and commitment from local, district and federal levels of government, in addition to community engagement of businesses and individuals to deliver recovery programs. Recovery objectives. The overall goal of the project is to improve the standard of living for Angalsi communities, focusing on the continuous supply of water, sanitation and hygiene services by 2025. This proposal supports 4 major recovery objectives which are developed from the Angalsi Post-Disaster Damage Assessment. Based on the damage and loss analysis, these objectives were developed to address recovery and reconstruction needs for the Angalsi communities. These objectives are recommended to increase the community's long-term recovery, resilience and future disaster preparedness. Major recovery objectives. 1. To increase access to vaccination programs for humans to address mortality and disease outbreaks. 2. Increase health vaccination programs for animals to protect critical livelihood and sustainability. 3. Increase minor and major assets for water, sanitation and hygiene conditions for improved quality of life. 4. Deliver community-led programs for funding for minor and major assets of equipment. Following these major recovery objectives, the Save Lives organisation aimed to achieve the following goals by 2025. 500,000 people from project areas in Angalsi have access to potable water. Destination from water source to household is not more than 500 metres in urban areas and 1,000 metres in rural areas. Improve sanitary and hygienic conditions in 500 households. The construction of 1,000 individual toilets. Equipment delivered for infant feeding. This proposal assumes Angalsi will be at long-term risk environmentally degradation due to climate change and drought for the foreseeable future. This proposal builds on the short-term emergency response as outlined to the Save Lives Situation Report of 2020. The key recommendation is to provide funding for assistance to ensure community-led sustainable development for long-term recovery. This can be achieved through the Save Lives Water, Sanitation, Hygiene, Health and Livelihood Development Program. Are there any questions or follow-up points? Yes. if you had to choose 2 recovery objectives instead of 4, what would be the most important? Good question. Number 1 and 3. Vaccinations of humans and water assets would make the most difference to the most amount of people. Thank you for your time, and that concludes today's proposal.